Have you wondered how something as small as the prostate can shape your life? This walnut-sized gland sits just below your bladder and influences urinary flow and fertility. Ignoring early signs of prostate trouble can lead to complications like chronic pain, infections, or even cancer. Today we take a step-by-step journey to uncover the prostate's function, common conditions, and clear paths to diagnosis and treatment. The prostate is about the size of a walnut. It sits just below the bladder and wraps around the upper urethra. Its main job is to produce seminal fluid, the nourishing liquid that transports sperm. Though small, its function is essential for fertility and urinary control. Grasping its location and role lays the foundation for spotting early signs of trouble before they escalate. As men age, the balance of hormones that regulate prostate growth shifts. Testosterone levels gradually decline while a form of estrogen increases, triggering cell changes that can lead to benign enlargement, known medically as benign prostatic hyperplasia. 3/4 of men over 50 experience some degree of enlargement. Inflammation of the prostate, or prostatitis, comes in two main forms: bacterial and non-bacterial. Bacterial infections often result from a urinary tract infection spreading to the prostate. Symptoms can be sudden and severe, with fever, pelvic pain, and difficulty urinating. Non-bacterial prostatitis may stem from an overactive immune response or stress, leaving men with chronic discomfort. Prostate cancer, in contrast, develops when abnormal cells grow uncontrollably within the gland. Risk factors include age. Most diagnoses occur after 60, family history, and certain genetic mutations like BRCA1 and BRCA2. African American men, too, face higher rates of prostate cancer, and often at younger ages. While we can't change our genetics or age, awareness of these underlying causes helps us choose when to seek medical advice. If you notice changes in your urinary patterns or persistent discomfort, it could be more than just aging at work. Recognizing the warning signs of prostate issues is vital. One of the most common symptoms is increased frequency of urination, especially waking several times at night. You might struggle to start or stop your urine stream, feel like your bladder never fully empties, or notice a weak, dribbling flow. Some men experience a sudden, urgent need to go, accompanied by discomfort or burning during urination. Others report pelvic pain, aching between the scrotum and rectum, or pain during ejaculation. Frequent nighttime visits can disrupt sleep and affect your mood and energy. Some men also notice blood in their urine or semen, a sign that should never be ignored. These symptoms can stem from enlargement, inflammation, or even early-stage cancer. While occasional discomfort may feel like a minor annoyance, persistent or worsening symptoms deserve attention. Remember, none of these signs automatically mean cancer, but they all signal that something is off. Honest conversations with your doctor and timely reporting of these symptoms can lead to quicker diagnosis and less invasive treatment. Don't let embarrassment delay care. Early recognition and action are your best defenses against progression, giving you the control you need over your health and your quality of life. Once you or your doctor suspect a prostate issue, a series of diagnostic tests can confirm what's happening. What if a simple exam could save your life? The first step is often a digital rectal exam, or DRE. During this quick, office-based procedure, your physician gently inserts a gloved finger into the rectum to feel the prostate size, shape, and texture. It takes less than a minute, and while it may feel uncomfortable, it provides critical information about nodules, asymmetry, or areas of hardness. Next comes the prostate-specific antigen blood test, known as PSA. elevated PSA levels can indicate inflammation, enlargement, or cancer. Because PSA can rise for non-cancer reasons, like infection or recent exercise, doctors interpret results in context, sometimes ordering repeat tests to confirm trends. If PSA remains elevated or DRE findings raise concern, imaging studies follow. A transrectal ultrasound uses sound waves to create real-time images, helping measure prostate volume and guide biopsies. In some cases, an MRI offers even clearer detail, distinguishing suspicious areas for targeted sampling. Biopsies involve removing small tissue samples to check for cancer cells under the microscope. Though it sounds daunting, modern imaging and biopsy techniques have become safer and more precise. In addition to these core tests, doctors may check urine samples for bacteria or inflammatory markers. Complete blood counts can reveal signs of infection, while specialized blood panels assess kidney function. Together, these tests ensure that treatment targets the right problem and avoids unnecessary procedures. These diagnostic steps work together, painting a comprehensive picture that guides personalized treatment plans, reducing uncertainty and focusing care where it's needed most. Now, let's look at treatment pathways. Ready to explore options tailored just for you? Treatment for prostate conditions depends on the specific diagnosis and its severity. For prostatitis caused by bacterial infection, antibiotics form the cornerstone of therapy. Depending on the bacteria, a course lasting 2 to 6 weeks may be necessary. Pain relievers, anti-inflammatory medications, and warm baths can ease discomfort during recovery. In cases of non-bacterial prostatitis, lifestyle changes, such as reducing caffeine and alcohol, and stress management techniques often help, alongside prescribed pelvic floor exercises, when benign prostatic hyperplasia, or BPH, is the issue. Medications like alpha blockers work by relaxing muscle fibers in the prostate and bladder neck, improving urine flow within days. 5-alpha reductase inhibitors act more slowly, often requiring 3 to 6 months to shrink the gland by blocking the hormone DHT. For persistent or severe enlargement, minimally invasive procedures like transurethral microwave therapy or laser ablation can remove excess tissue while preserving function. In the most extreme cases, a prostatectomy, the surgical removal of part or all of the prostate, may be recommended. Managing prostate cancer involves a broader spectrum of options. For slow-growing, low-risk tumors, active surveillance allows regular monitoring with PSA tests and imaging, postponing treatment until necessary. Localized cancers may be treated with surgery, radical prostatectomy, or radiation therapy, which can be delivered externally or via implanted radioactive seeds. Advanced prostate cancer may require hormone therapy to reduce testosterone levels, chemotherapy to attack rapidly dividing cells, or newer immunotherapy drugs that train the immune system to recognize cancer cells. Each treatment path carries potential side effects, from urinary incontinence and erectile dysfunction to hot flashes and fatigue. That's why shared decision-making between you and your doctor is so critical. You're not just a patient, you're an active partner in choosing the approach that best balances effectiveness with quality of life. Regardless of the path, modern medicine offers multiple routes to manage prostate conditions effectively, aiming to restore your health and maintain your daily well-being. Always discuss side effects openly with your healthcare team. Regardless of which treatment you choose, regular medical follow-up is essential. For men over 50, annual visits should include a review of urinary health, PSA levels, and discussions about any new or lingering symptoms. Imaging tests or repeat blood work may be scheduled at intervals to track progress or detect changes early. Proactive monitoring helps catch recurrence or side effects before they become serious. It also provides a chance to adjust medications, add supportive therapies, or explore new treatment innovations. Remember, taking charge of prostate health doesn't stop after a diagnosis or procedure. Ongoing partnership with your healthcare team ensures that you adapt as your body and needs evolve, keeping you informed, empowered, and on the path to long-term wellness. Your active role makes all the difference in outcomes. As we've seen, understanding the prostate's function, recognizing warning signs, and pursuing timely diagnostics and treatments are the pillars of proactive prostate health. No matter your age or risk, knowledge and action are your best defenses. Stay connected with your healthcare team, ask questions, and trust your instincts when something feels off. Some men experience a sudden, urgent need to go, accompanied by discomfort or burning during urination. Click the link in the description to learn more.